Trauma guidelines suggest that all patients with an acute traumatic subdural hematoma greater than 1 centimeter be surgically evacuated regardless of the patient's GCS. As the population ages, however, there is an increasing number of elderly patients that exhibit minimal mass effect and symptoms despite harboring an acute subdural hematoma greater than 1 centimeter. This study's key question was, in non-operatively managed patients with minimal symptoms, does subdural hematoma size greater than 1 centimeter independently predict in-hospital mortality? We performed a single-center retrospective review of all adult patients that were hospitalized with an acute traumatic subdural hematoma greater than 1 centimeter in size, managed conservatively due to minimal symptoms and/or minimal mass effect. Patients were 2-to-1 propensity matched to patients with subdural hematomas smaller than 1 centimeter based on age, GCS, injury severity scale, and Rotterdam CT score. The primary outcome was in-hospital mortality. Secondary outcomes were discharge disposition, length of stay, radiographic progression on serial CT scans, and the rate of operation for chronic subdural hematoma formation. 135 patients were included in this study. There were no differences in in-hospital mortality between patients with large and small subdural hematomas. This slide demonstrates the breakdown of discharge dispositions between patients with small and large subdural hematomas. Again, no difference was seen between groups. Length of stay was also similar between both groups as well. Patients with large subdural hematomas trended towards higher progression on follow-up CT scan and higher rates of chronic subdural hematoma surgery, but neither reached statistical significance. In conservatively managed patients with minimal symptoms and mass effect on a CT scan, increasing subdural hematoma size did not contribute to worsen in-hospital mortality, discharge disposition, or length of stay. Future studies are needed in order to evaluate the long-term functional outcomes following a non-operative strategy in this patient population.